you ask him to describe himself, Bob Schapper will tell you that he's just a regular guy, but with a resume that boasts more than 25 years of leadership experience at some of the nation's top medical facilities, it's obvious why he was a natural choice to fill Tahoe Forest Hospital District's vacant CEO position. So writes the Sierra Sun last year. It's my pleasure to introduce you live to Bob Schapper. Bob, welcome to the show.
Thanks, Maya.
Yeah, it's nice to have you here.
Thank you for the kind words. I appreciate that.
Well, the Sierra Sun was pretty effusive in their description of you, and now you've been with the hospital district, what, 4 months?
Just 3 months, yeah.
All right, congratulations.
So, thanks. It's great to be here.
How did the first 90 days go?
Wonderful, wonderful. The people are wonderful. The board, leadership, medical staff, just great people, great community. And they've welcomed me with open arms, so I'm really appreciative of that.
You've got a really interesting background, Bob, and we're going to get into some of your healthcare background. But before we do, just introduce us, if you will, to your family. Who did you move to Truckee with?
Oh, well, my wife, Marcia, of 20 years. Our anniversary actually is this next month, so 20th anniversary.
Great.
So we're excited about that. My son, Casey, who's 12, and he has already told me just actually a month here how much he loves it. So it's a great transition for him. And Marcia's very excited to be here too.
Especially for a 12-year-old, that can be a tough time.
Oh, he looks at these mountains and says, "This is great."
Let me go play, Dad.
Absolutely.
Is Casey into sports up here? Or?
He is. He is. He likes to ski, and so he's excited about skiing. He's already been skiing, and he's been off on a sled. And at the same time, he loves basketball and baseball. So he's looking forward to getting to know kids in the neighborhood and just in the school and start to play. And he's already started playing basketball in the rec league. So
oh, great. Well, it sounds like you guys have really just slid right into Truckee life.
Sliding really right into it. Yeah.
Well, let's go backwards then. Let's work our way backwards. What's your background? How did you get into the healthcare field?
Well, it's kind of ironic. I had not planned that. Actually, I wanted to be the third baseman for the Dodgers, not the Giants.
Dodgers.
Not the Giants.
Uh-oh. We may have to end this interview right now.
But I found I really didn't have quite the talent to be able to do that. And I had a cousin who was a neurosurgeon who I was close to growing up in my formative years, and just kind of through his influence got involved in medicine and ultimately decided I wanted to have a career in healthcare administration, and not necessarily hospitals, because I had an interest in public health as well. But I found actually when I got my first job while I was in graduate school that the most important impact on me was that, gosh, what are these administrative folks doing, and can you really influence change in these organizations? And I decided that for me I needed to go forward and continue my graduate training, and so I did so and followed a career path in hospital administration.
And when you talk about affecting change in hospital administrative structures, what kind of changes did you see that were necessary?
I think it was really being in touch with your employees, who I've learned through my career are truly the most important asset that you really have in any organization, but certainly in a hospital setting. Having an organization that is open, a lot of communication, a lot of esprit de corps, and ability really to, as I call it, kind of manage resources up so that patients and families in the community really get the level of care that they need to have. And for managers like myself and leaders like myself to really recognize that that's where the assets are, the people who are on the front line.
Well, you've just been with Tahoe Forest Hospital now 90 days. What are some of the challenges that you see in our district?
Well, we have a tremendous asset here. I have to tell you, I've been very impressed with the management staff, the employees, just everyone who's been associated with the hospital. And one of the unique things is that we have a very committed board of directors. And I say unique, not in the sense that boards aren't committed in other communities, but you really have a very passionate group of people who really look to this hospital system, so to speak, as a truly valuable asset to the community. And with that level of passion, it's really easy to see that that can really be brought forward by example throughout the organization. And it has been, and you have a great legacy here through the past leadership. So I'm very hopeful that what I can do is take what's been great in the organization, help refine some of those elements, and just kind of tackle the challenges that we have in the future.
And focus on the good stuff.
You bet.
What are some of the changes in the healthcare environment as a whole that are going to be impacting Tahoe Forest, and things maybe that local citizens should be made aware of, educated about?
Well, I think the greatest volatility in healthcare is the issue of how to get access to your physician, what you have to pay for health insurance, changes in behavior of employers and how much an employee will pay as a
Right.
portion of their health insurance is very big. Physicians are finding that their reimbursement has significantly shrunk through years, but more recently because of the continued cuts in Medicare. So there's a much more difficult kind of mentality in healthcare about how we're really going to be able to pay for this, and that's a big challenge in terms of the employer side as well as for the provider side.
Now, we've seen that on a national level where a number of large labor organizations have been striking or near striking, and at the core of the debate is how much of their health care insurance employees are willing to carry.
And I saw that on TV just recently.
Yeah. Now, in our community, especially, I think, we've sort of grown accustomed to the burden of carrying, not having sufficient insurance available to us for the physicians that are here in the area. In other words, you may have insurance from an employer that doesn't cover the physicians that are here in this area. And is it Tahoe Forest Hospital District's responsibility to address that, or is that a larger issue than the district should take on?
That's a great question. Our hospital boards, in giving me some of their sense of priorities as I've entered the system, have really looked to our organization to really be a leader in helping to solve some of those problems. We are actually involved, I should say, with a number of the employer groups, starting really with the public agency employers, and then starting to look at the larger employers and see really what their issues are, see if we can define them more effectively and find some solutions. Our physicians, I can tell you, are very interested in maintaining local access to patients who live in the community. I really believe our employers want the providers, both the physicians and the hospital, to be able to be open to that. So we really have to bridge that gap, and I think we can be a catalyst for that in the future if we work hard at it.
I think the good news is that the various parties want to bridge that gap. There isn't anybody that doesn't want that need to go taken care of.
But it is a tough challenge.
What are the specific challenges that would face Tahoe Forest Hospital District as a rural provider versus a big city hospital?
Well, fundamentally, I think one of the challenges that every rural hospital faces is the perception that community may have that it doesn't provide the level of quality care and medicine that the big boys do. But I would tell you from my experience, having been a CEO in an academic hospital, that this hospital provides superb care, not only from the patient satisfaction side where you have TLC, but the technical quality is there. It's hard for a community to really understand, but physicians that are in this community are from Stanford, from Harvard, from UC Davis, from UCLA, some of the finest medical universities and hospitals that are the teaching centers where they trained. And they bring all of that knowledge and that expertise to this small community. So it isn't the edifice per se, it really is what is the quality resources that you have. And the same is true for many of the employees who have come here and been a part of the community. They were trained in very, very excellent institutions. So we have great clinical medicine here. We have great access for primary care, wonderful caring staff and caring medical staff, but it's really trying to reinforce that message to a community that may not quite understand that bigger really isn't better, better's better. And I think that's the real message for us to reinforce to all the people who are here.
That's an interesting challenge. Why do you think you're able to recruit such a great caliber of physicians and medical staff?
Well, obviously the location here is
the
wonderful.
reason we were able
the
to
lifestyle.
recruit you.
Well, that's one of the reasons. But the lifestyle here is wonderful. But at the same time, I think physicians really want to practice in an environment where they're really free to provide the quality of care to their patients that they would like to. In many of the major urban areas, the managed care plans have really restricted their ability to practice as freely as they would like. There's a lot of frustration in those kinds of markets. So physicians really are attracted to a place where they can work and be doing the clinical work that they're trained to do and do that with a sense of freedom and monitoring within their own groups rather than by an insurance company, which is really part of the problem that we see with managed care right now.
How much interface do you have with the insurance industry? Do you go to battle with them? Are they allies? How does that work?
Well, we have battled with them. I think that it's a complex problem with the insurance industry. The insurance industry's job is really try to provide a product that an employer can provide or an individual can purchase at a reasonable cost and to be able to do that on a basis where there's local access to care for wherever the individual happens to live. That's really the business that they are in. Managed care has shifted that over the last few years, where physicians are more at risk and hospitals are more at risk, and the insurance companies don't behave as much like insurance companies. So that has really been a negative backlash in healthcare. So what we're really trying to do here as a hospital, and I think as a physician provider community, is work with these health plans so we can get fair reimbursement for what it really costs to provide care, particularly in a market that's more expensive, and to be able to do that in a fair way and have fair reimbursement. And that's really how you try to interface with the health plans, hopefully on a reasonable level.
Do you see that going down a productive road?
Well, I think it can. It all depends, and I am fairly new again in that process here, but one of the challenges we do have, like I mentioned earlier, is that we are going to be working with our plans, and we are going to be working with the employers here to assure ourselves that we really are paying attention to what's important to the people who live in this community and work in this community.
That's a great thing to know. When you talk about taking care of the employers of the community, Tahoe Forest Hospital District is one of the largest, if not the largest, employer in the community.
Yes, we are.
Over 500 employees year-round.
Yes.
That's a
yes.
significant number.
It's a very large group, and we have, and in my style of management, is I truly do have a responsibility for those families and those employees to make sure that we really are doing the things that help to promote the quality of life and the quality of services that we want to provide to our consumers here. So, you know, it is an important business and an important asset for the community as well.
And it also provides you that double-edged sword of looking to provide the proper kind of medical care for the whole community while also taking care of the medical benefits for your own employees.
It is difficult, and we do have the same behavior sets and as an employer,
Right.
and trying to figure out how to economically provide the same kinds of
Right.
services to our employees as the other employers in the community are looking for. But
And now that's an interesting point, and I think probably most people in our community are aware of this, but it bears repeating. The hospital district is a quasi-governmental agency.
yes, it is.
It's a publicly elected board,
Yes,
and it's Placer and Nevada counties
that's our service area.
is your service area,
Yes,
right?
and that's our district service area.
And your
correct.
tax base
Yes,
is both counties as well.
predominantly it's Nevada County.
Mhm. What are the challenges of working as a government agency versus being in a private hospital?
You know, I think one of the great advantages is that when you're open and public, people can get involved and really be engaged in the process of really making good decisions and debating freely what's important in the service level of the community. So that's a very positive part of the public side. I think the challenges associated with the public side is how to be able to organize those efforts efficiently and be able to do that effectively and make sure that communication is optimized. You see less of that need to do that when you're in a community not-for-profit or you're in a for-profit system, which is really those are more closed systems than the public system that we're in. But any way you cut it, the advantage for us is that we have the opportunity to really take this asset, have people truly understand the scope and the value of it, and hopefully get behind and reinforce the efforts that everybody has put forward thus far.
And support it. I think that's an interesting point because it was the community that launched this hospital over 50 years ago. And they saw the need for it. They created it. Philanthropy from Ozzie McIver and her family, the Joseph family, created the land donation for that.
And I had a chance to meet her, so
Oh,
it
great.
was wonderful to be able to do that.
There's a piece of
So-
Truckee history for you.
I understand that. I understand
It's
that.
really
You know, the
something.
real keys to this are that it is a tremendous asset that most of us, and so I am that regular guy I talk about, and so I don't really think about health care except for when I'm, you know, on the job per se. I'm a regular family guy, and I really don't worry about that until all of a sudden something is going to happen.
Right.
And when I enter the system is when I have an expectation of high response, high quality. And so in effect, I really feel that as a consumer, I really understand what we need to be delivering in our system. And I say a system because it isn't just the hospital piece. It's all the things that everybody has put together in building a healthcare system here in the community. It's our home health programs, it's hospice, it's the occupational medicine programs, it's what we do down at Incline Village with the facility there, and all of the activities that surround the physicians and the consulting that goes on to make sure that patients can access a quality service. And I say that, bigger isn't better, better's better. And that's what we do.
How will you measure that? How will you know that Tahoe Forest Hospital is better?
Well, we have an opportunity approximately a year or so ago to participate in a study, which was called the Pepsi study. And it really was a study to try and look at patient satisfaction. And actually, Tahoe Forest ranked higher than any of the hospitals in the Northern California marketplace in terms of patient satisfaction. So we do have mechanisms to be able to assess that. We do that on an ongoing basis. Many patients get phone calls back from outpatient surgery. It's really about service. And part of the philosophy that I have in terms of not only measuring that, but having that continuity in that process is healthcare is a bit of a calling. It's not just a business of taking care of people. You really have to have, and we ask all of our people to have the heart that they apply to this. You know, really feel that they do make a difference every day in the lives of the people they serve and work with. So it's a very different way possibly to look at it, but I think it's what makes an organization like ours very, very positive attribute to the community.
Yeah, I hadn't thought of it in that way, but I think you're right. A calling is a much better way to look at it than a profession. And the people that I've dealt with at Tahoe Forest Hospital certainly seem to be the most dedicated group of folks that I've run across. Let's talk about what's the future for the hospital. Bob, what's next for Tahoe Forest Hospital?
Well, you know, everybody is very excited about the work that has gone on over the last couple of years in getting prepared for the Western Addition. And this new addition really is going to replace the old acute area of the hospital to give us 35 new acute beds, of which a majority of them are going to be private beds, and allow us to really have a more current facility for the inpatient side, and it'll update a number of the outpatient areas where ambulatory care, which is not overnight stays, but stays where you come in during the day for a service and leave, where those areas will be absolutely more modernized as well. So the facility here will absolutely be state-of-the-art in about 2.5 years. We're looking to let those contracts in April as really the second phase of a project, because we already had completed the construction of 2 new ORs to be able to accommodate our surgeons here earlier in the year.
Now, that must be pretty exciting to step into a project that large. Part